We're joined now by Cheye Calvo, who is the mayor of a town in Maryland and had his house raided by a SWAT team. Mary O'Grady, who covers Latin America for the Wall Street Journal. And Radley Balko of Reason Magazine. So your questions or comments? Yes, sir.
Yeah, with the new immigration law in Arizona, there's been a lot of talking about stopping human trafficking across the border in Mexico. I was wondering if you think putting those laws into effect would have any impact on the drug trafficking that goes on?
Mary, that sounds like it's for you. It is a 3,000-mile border, and I really thought they were going to close it when they got the electronic devices, and that's been a total bust.
Yeah. Actually, I think it's the other way around. I think if you, basically the drug prohibition and the high demand in this country has created these massive organized crime networks. And those networks don't just traffic in drugs, but they also do human trafficking, and they also are expanding their businesses into the United States. So, you know, there's been a lot of discussion today about how, prohibition creates crime rather than reduces it. And I think this is just an example of how it makes that problem worse. Yes, sir.
Gary Johnson, the former governor of New Mexico, is currently a possible candidate for the 2012 presidential election. He's also currently one of the highest officials to ever openly advocate for the legalization of marijuana. How do you feel that his position would affect his Republican, constituency in the primary and a possible presidential run?
Anyone? You're the politician here.
I really can't speak to it other than to say that, I would argue that trying to come up with a single answer to this problem is someone who has a lot more confidence than I do. I think the reason federalism makes sense for this answer is that when you don't have a clear answer, allowing states and communities to try new things is a way to inform the actual public policy development going forward. And I think people who try to answer in a one size, the nation has to do this, is probably making a mistake. I think we need to learn some things before we rush into a new federal policy. But I think what we know now is the current policy is not working.
Well, and Johnson is a Republican, and I would actually argue that the continuing the policies that we have right now with respect to the drug war is not a conservative position. I mean, it's wasteful, it's not working, it vastly expands the size and influence and scope of the government, the federal government. And, what Mayor Calvo suggested, a federalist approach actually is a very traditionally conservative approach. It's an idea of letting the state sort of experiment and find policies that work, and then perhaps, other states will then copy the policies that are successful.
Also, the rule of law comes from the norms and values of the population. It's not something that can be imposed from the top down, so that's another reason why federalism makes a lot more sense, because whatever the local people believe in terms of how different mind-altering substances should be used should be part of what formulates the rule of law.
And Ron Paul is another politician who got a lot of votes last time. He holds that belief. Yes, sir.
Where does the mentality come in that people believe they can dictate to other individuals what they can ingest in the first place or anything? Where does the authority come from for drugs or any type of activity?
Well, you should ask Mayor Bloomberg. I mean, he doesn't want us to eat fats.
Right. So my question was going to be directed towards John. The second part of, if you are aware of Murray Rothbard and the stateless society, no force because government is coercion through and throughout. So I don't know.
It's certainly been generally accepted that government can do whatever it wants, and the limits that I thought were in the Constitution get ignored. I think it's a good question. I wish we still had the pro-drug war folks here to try to answer that.
Well, let me try. I think that what they would argue is that there are externalities. There are results of people using drugs that overflow into the rest of society, and that's their justification for wanting to control the use. I'm not defending that position, but I think that's where their argument would come in. And particularly, as I mentioned before, we do live in a welfare state. So if you have lots of people who have a problem that makes them dysfunctional and creates, as I say, an externality, then the society as a whole is going to be asked collectively to do something. And we already see that with treatment programs and so forth. So I think that's part of the mentality of trying to control the supply. Yeah. I don't think it works, and I think it has much more costly unintended consequences, but I think that's where they're coming from.
And that argument gets easier to make the more, the more expansive the government's role in healthcare, for example, is. Now you can start making the argument, well, we need to crack down on saturated fats and salt.
Another reason to limit the government's role in healthcare. And that's our internet show for today. If you want to join our audience, tickets you can get at johnstossel.com. Please come, and thank you. And thank you.